Hello and welcome to another edition of Health Show with Amara from our London studios. Like always, we are bringing another very important health related topic, and today's topic is adolescent mental health. Adolescence is a crucial period in developing the social and emotional well-being in order to grow into adulthood where one can have a calm and peaceful life. Recent global events, including the COVID-19 pandemic, ensuing lockdowns, resulted in rise in mental health problems, not only amongst adults, but also amongst young people. And globally, 1 in 7 individuals between age 10 and 19, they are diagnosed with some kind of mental health condition. These mental health problems, they make these individuals vulnerable to social isolation, discrimination, poor performance or behavior with their peers as well as in schools. And not only that this has got an impact at the time, but the extension of these issues into adulthood would result in major problems in their later lives, not only mental but also physical. Failure to recognize these problems has got a major impact on the burden of these mental health issues globally. To address this, we have invited today Dr. Raquia Bano, who is a well-known GP in Coventry. She takes pride in fostering her relationship with patients and the holistic approach towards treating the conditions as opposed to just treating the symptoms. Let's welcome Dr. Raquia Bano. Hello, Dr. Bano. How are you today? And thank you very much for joining us on a bank holiday weekend.
Hello, Dr. Amara. Thank you very much. I'm fine. You asked me how I am feeling today. I'm fine. Thank you for giving me opportunity to call me to discuss about the topic you wanted to talk about today.
Yeah. So, we are talking about mental health problems in adolescent age, and we want your experience as a GP on how common mental health problems are in youngsters and what are the commonest ones that you come across in your day-to-day life as a GP.
We can say that on national level it may be quite high because depending on the population, what kind of population you have in your surgery, and depending on, because it depends on social and racial issues as well. Not we can say racial, but it depends on the society as well as the prevalence of the people who are presenting in that practice. That depends on the number of people or the number of children present in this scenario of anxiety or depression. It is not very common in my practice, if I say in my practice, although I can say that maybe it is 1% population to one stage they come and present with one or other sort of mental health issues.
So do you think that the young children, of course they can't present to you directly, it is the parents who bring them in. So do you see that there is a reluctance in parents bringing their children when they see that there could be a problem? Because it may still be considered as a stigma.
To a certain extent, I can say that parents do have some sort of stigma of, or I feel that it is lack of knowledge about the children mental well-being, that or the parents do not understand their child is going through some sort of problem, because they think it is just like a moody or tantrums or something like that. But when it comes to the disruption of daily chores, then they come to the knowledge that this is something more than the tantrums or more than the normal behavior of a child. And then they seek medical advice and come to the doctor to discuss about what is happening. Mostly it happens that usually parents come with physical symptoms. For example, their child is avoiding going to school in the morning. They complain of abdominal pain and or headache, which is not measurable. Both things are not measurable if you understand how much is pain in the tummy, how much is headache. So they usually present with physical symptoms rather than mental symptoms. So then we have to rule out what is the main cause of the symptoms.
So how do you make the diagnosis of a mental health problem as opposed to a physical issue there?
Yeah, usually parents expect doctor to find out the reason, physical reason. For example, they think there is some sort of deficiency or some sort of nutritional problem because they say that they are not eating, they are just avoiding contact with the siblings, or they're just preventing themselves to come to the family as the dinner table, etc. And so they think that because of lack of nutrition, they have some sort of medical problem. So their main aim is mostly at first presentation is to check the bloods, what is going on, and what is the, if it can be ruled out, if there is any nutritional deficiency or some sort of medical illness, like if they read on Google or read something online, they think that they might have had thyroid disorder or might have had vitamin D deficiency, which is very common these days. People think everybody has vitamin D deficiency. So they usually come with the expectation of doing the blood test. So when we do the blood test, of course we take a detailed history of the symptoms, how they've been happening, how long they last for. Usually children, if blood tests are normal according to the whatever we do the test, and we find out that their symptoms are only maybe in the morning and after school time, when school time is like school closes at 9 o'clock or 9:30, their symptom disappears as well, which is very indicating that this is not something organic cause, but it is more likely some sort of mental issues which is causing the symptoms in the child.
So in your experience, do you see that the commonest problems that you diagnose in young children is anxiety or depression, or there are other mental health related problems you see in young children? What are the commonest other problems other than just anxiety and depression?
Yes, usually parents come that they think their child is not doing well in the school, or they're too much hyperactive, or they're not intricating with the school or with the children, things like that. And they think they need to be assessed for autism or ADHD, etc., etc., which is very common actually complaint by the parents that they should be tested for that or assessed by that. But of course, it is very lengthy process to rule out or to assess for autism and ADHD. Usually school teacher or nurses at school, they pick up this kind of symptoms in the child, and they refer them to CAMS, which is Child Mental Health Services themselves. And if it is, because it's usually very long waiting time, they ask a GP to refer to them and do assessment as soon as possible. So actually, anxiety is totally different. However, autism and ADHD does correlate with anxiety as well.
So how do you make the diagnosis of autism or ADHD? Are there any special tests that you offer them?
There is no test. Only GP can refer to secondary care for assessment, because it is not beyond our approach or whatever. It should be come from the mental health services. So we usually refer them to the neurodevelopmental. One is the neurodevelopmental service in pediatrician, and they usually assess them, the child, and later on whatever is their whatever management, if they been positive for that, then they offer certain services and certain management plans to child.
Okay. And so are these children treated at primary or secondary healthcare? Or, I mean, as a GP, what kind of support do you offer not only to the children but also to the parents? Because of course any such diagnosis, it brings a lot of sadness in parents, and they have to be prepared to deal with with this diagnosis. So how do you offer support to parents and children in primary care?
Yes, there are support available for when it comes to the diagnosis, and they do it look holistically. They look for the family as well, what stress family is going through by the diagnosis. But as I said, that ADHD and autism is a vast kind of subject, which is not treatable at the primary level. So we mostly what we can treat is, or we can manage, is anxiety. We find out the reason behind the anxiety, and it's a kind of child and parent counseling together, which helps to recognize that what is the cause of mental illness or behavior problem. Mostly we call it behavioral disorder, that child is behaving a bit odd and not like a normal child. When parents come in, then we discuss both parents and child separately together as well, and then we diagnose that what is the main reason, and hence we treat them accordingly.
So what I'm understanding is that parents are now more forthcoming to bring their children for such diagnosis, especially when there are odd behaviors or reluctance to go to school. Do you think that in this day and age, the problems or these conditions are diagnosed more, and that's why we think that there is a rise in mental health problems? Or do you think the mental health problems, they have actually increased in the recent years? And if that is the case, what do you think is causing all these mental health problems in youngsters?
I mean, statistics does show that it is growing. This mental health illness is growing, and prevalence is growing as well. In UK, I have seen that there are 300,000 children who are having anxiety and some sort of behavioral issues. But that is main thing, as I said, acknowledging the symptom, recognizing them, and acting on them in the initial part of assessment or recognition will help to prevent further escalation, or you can say that further serious illness like depression. And you can understand, I have seen that suicide rate in adolescent is quite significant now, and it is on rise, unfortunately.
So do you think the changes in social norms has resulted in these mental health problems or increased suicide rate amongst youngsters? Do you think there are social issues?
I must say partly, because if, for example, if we differentiate the children who are more anxious, or they are having anxiety, depression, it is commonly in the families who are single parents, or maybe it's not always the system, always the problem, but it's more commonly in broken families, or the children who are actually born with this kind of personality, because it is some sort of genetic relation as well to is contributing to being anxious and panic and depression as well. Excuse me. So it is not only partly it is affected by the social norms. Of course, there is more gadgets, more information now, and isolation. Children are not being, and parents, see, both parents are working. Children do not have enough time to discuss their problem that they are coming across in the school or by the peers and by the other students. They might have been bullied in school, and if parents are strict, and I can say that in Asian culture, we always blame children. They are the culprit, not the teachers. And they must, or the students. They should behave properly, and this is why our children are more reluctant to discuss their problem at school they're facing with the parents than the other children. So it is important that we should educate. I believe that before this parenting hood should be discussed when people are pregnant or when they're planning to be having baby. They should have education how to raise their children.
Yeah, of course, parenthood is a big responsibility, and it's not just about bringing the child into the world. It's the nurturing and upbringing of the children is very, very important. And as I'm hearing from yourself that all these social or cultural issues, they can have a major impact. So do you think, what is your view on how the parents can be prepared to deal with the problem when a diagnosis of a mental health is made? Do you think parents' acceptance is there, or they always are in denial that no, it is not a problem with the mental health? It could be behavioral issue which can be sorted just by being strict or keeping the child disciplined. Do you see it? Because in our culture, in my childhood, I don't remember that there was any such thing called mental health problems in children, and now we see more because if a child was aggressive, it was considered to be poor upbringing. So do you think that there is a difference in the cultures, how there is acceptance of these problems in children?
Yes, you are right to a certain extent. In Asian culture, definitely parents do not accept their child has a behavior problem. They think it is just a tantrum, not a tantrum, or they are abnormal, or they are not behaving good. But in other society, I can say that, for example, opposite non-Asian people, they understand their children from the very beginning, and they try to seek medical advice as early as possible. So they have different actually problem, and our Asian community has different. Main thing is that denial, that they do not understand what is the mental tantrums, what is the mental illness or behavioral disorder children can go through, or it is too late, because it is a bit of a tragedy that we are actually in a society where our children are spending more time in school rather than at home. So they have two different kind of situation. For example, if we are too strict at home, in school they have not as much as, you understand that schools are very liberal and they are very polite in teaching children, etc. So this difference of the culture, difference of the environment also make our children to think in a different way. And this is why I feel that because our children has, when they come from school, they have to do certain chores, like religious chores as well, plus other thing, discipline, do this, do that, not going out, you're not allowed to do this. And this is hence children become more upset about it. Why can't we? This is the main question they ask. Why can't we, like other children? So this is why I'm saying that parents are. It is more important to educate the parents so they could understand their children's psyche and they could manage their problem at the home level as well. If it is not manageable at home, they should seek medical advice.
So do you think as Asian parents, we put our children more under pressure, and these are not just the pressure of trying to fit into the culture, but also educationally we want them to be in the top 3, and we want them to choose the professions of their parents like, rather than what they want to do? Do you think this kind of cultural pressures can lead to mental health in children?
To a certain extent, but not. It is not very common now, because parents are understanding more now. We parents who have come from abroad, we have that some sort of thinking in our brain that our children should be doing very well academically, etc. But now children have lot of choices, and I have seen even Asian parents, they do understand their children wishes, and they let them to go whatever they like. So it is not the case. It is mostly, I believe, is that children have some sort of cultural difference which is making them upset or the anxiety and panic attack, etc. Because if they do anything wrong, they feel guilty inside and they cannot speak to their parents because parents cannot tolerate any misbehave. So this is how they started hiding the facts, and hence it turns into anxiety and panic attacks and depression, etc.
Yeah. And other thing is, what I'm sure you would agree that there are some cultural pressures within our society, even though we have lived in UK for a long time, but still our expectations are from our children that as soon as they finish their educational qualifications, they get a job, and the next thing is that parents, they put them under pressure to get married and then start their families as soon as possible. Do you think it is fair on our generation born and brought up in this country, that we don't allow them to actually enjoy their lives because that constant pressure? First, do well in education, get the qualification, get the job, because as if like they have to prove a point, and then get married and produce children as soon as possible. Do you think that is fair?
Discipline-wise, it is fair, I must say, but it is not the case, Amara, because if you see that, yes, if they've been having given certain goals to a child with I must say, I must stress that with good friendship between parents and the children, if they tell them or educate them, if they are pressurizing them for this and that, what is the reason behind it? Because being jobless in later life also bring depression in the children. So who is responsible for that? Will child blame their parents that did not educate them or did not make them aware what is important, what they have to face in their life in future? So to a certain extent we can say that, but it is important that we educate them from the beginning. So I don't blame the parents if they say that why we are stressing you being academically good and to do good in the life and because you will get a good job, etc. It is not wrong, because to a certain extent it is just like guidance. Rest is to the child what they like to do, and we should accept that yes, if their aptitude is not for medicine, engineering or soliciting, they can go to any other education or any other line where they can maybe perform better than doctors or being engineers. So we should accept that. This is why parental education is important.
Yeah, no, I agree with you. And of course, like it is understanding and merging with the culture, understanding what are the social norms rather than putting children under a lot of pressure. And these are mainly cultural pressures. So on a different note, so once a diagnosis of a mental problem is made, are there any medicines that are used to treat any such mental ailments?
That is only for severe kind of, where there is no medicine for initially for anxiety, severe morbid anxiety where children are not functionable. Yes, they are given some medical treatment, but psychological support and other sports like psychology, counseling, CBT, cognitive behavior therapy, all these are kind of non-medical treatment. But when it comes to too much of restlessness, sleeplessness, insomnia, etc. Yes, we do give some mild kind of treatment which can help with that. But mostly at the young age, we treat them by counseling or by the help and listening to them, to the parents, because there are a lot of services like RISE, COOT and other children's service which do help children a lot, and children have facility to ring them on after the age of 11, which is quite significant, and they can speak to these services who can help them. Many children even do not go to the parents, they look online or speak to the nurse and they go to these services themselves.
Yeah, so how easy it is to get access to these services in the community? Because of course, like we do see there are waiting times, long waits to access any such supportive services within primary or secondary care. So if a child is diagnosed with a problem and you think that they need supportive care or counseling or even CBT, are there long waits or the access is quite prompt?
Of course, maybe 2 years.
Is that what
maybe
it is? And
more than that, maybe less, depending on the situation, that how bad is the situation. So it is long waiting time. It is very frustrating for parents as well, and for the patient. But I personally, or my clinical knowledge, say that good counseling and frequent visit to the doctor, listening to parents and the children does help a lot, because I myself can say that how many people I have seen, and just by counseling and listening to them and giving them chance to what they can do, or giving them some sort of guidelines, they have improved quite significantly in their symptoms.
Yeah, that must be very frustrating for the parents when you tell them that the wait could be 2 years, because of course
we don't tell them we don't tell the waiting time, but we just tell them it is long waiting time, and this is why they visit frequently to the doctor. We didn't hear anything from secondary service, what we should do, can you expedite it, etc., etc. The pressure is everywhere. I can understand that it is lack of maybe the professionals and shortage of professionals, and we can't do anything at primary care because diagnosis is important. However, if parents come, for example, autism and ADHD is totally different, Amara. That is not at the manageable at primary level unless it is being delegated after assessment to the GP for further management. What are the plans? Then we can do those plans, or we can adjust, or we can manage them in community. Otherwise, these two conditions, even severe depression, it is not like manageable at the primary level. So I'm stressing is anxiety and panics and minor things which can be dealt at primary level. They can be dealt at that level without any treatment, medical treatment, by good counseling and good package of care that helps with the management, rather than these serious problems, which is only and only probably diagnosis is important and manageable only at secondary care.
So children who are diagnosed with mental health issues, we just hope that their schooling is not affected and they are not discriminated within the schools, and the staff in schools, including teachers. How do you think that they've got enough knowledge on how these children should be supported in their educational or academic performances?
The school does understand. This is where, when the children being referred to the camps, and nurses also pick from the school and from the students if their disruptive behavior in school. This is where the initiation help and start, and they pick on these things. They do refer themselves to secondary care. Is the problem arise only when it is not being seen within a certain time limits, and when parents become very uptight with the condition, then they see the GP to expedite appointment or assessment. But I don't say that school are not recognizing this condition. They do recognize, and they do refer children to the secondary care. Yes, if children are, for example, they do something out of class, they may not pick it.
All right. Yeah, it's, of course, if the schools are, they understand the problems and they offer the required support, do you think that these children, they are vulnerable to have this feeling of self-isolation, or they become detached from the rest of their peers because they feel that there is something not right about them? Do you think that they do take it as a stigma attached to them?
Yeah, this is the main thing, that they are vulnerable. They are shy from the beginning. They're born shy. They're born with, for example, if they are not like very much into introvert, we can say, or extrovert, whatever, they are being picked by, you know, that children are naughty anyway. If they bully one child, even if he is normal, he started being isolated and stopped going to school, and he actually, his academic values or academic achievements also deteriorate because they are not happy going to school. They are being picked by other students. So this is very difficult. In this scenario, it is very difficult what to do with the children, and where I don't think so teacher or school nurses can do anything, because it is the both sides. It is the children themselves who are actually hurting each other's feeling rather than the mental illness.
Yeah.
And you know that children have a different mentality, and they just, some are bossy and some are submissive. So this is where the vulnerability comes from.
Yeah. So, for parents, what are the signs parents should be looking for when a child is going through a mental health illness, which may result in them taking very harsh steps, including self-harm or suicide? What are the signs that you would advise to parents to be looking for in situations like that?
Yeah, I must say that from adolescent, from year 11 onward, or even from the year 5, how the parents pick it, because child started coming with some sort of physical symptoms, as I said, headache or abdominal pain every day for no reason, or avoiding going to school, deterioration in their academic achievements, etc. This is how parents come aware that, oh, what has happened, that why they are doing this, and why they are complaining of abdominal pain, headache. Some parents are very intelligent. They do pick it, talk to the child, and of course, if parents are sportive, children will not have any shyness to the parents to tell what is happening with them at school. So they deal it at their own level. When it is beyond their approach, then they seek the medical advice that it is something more than this. Yes, reassurance is good, that we say we exclude any medical cause of the symptoms. When we exclude it, then parents understand what is the main thing. It is more likely problem at school or at home. Maybe parents sometimes they themselves has problem among the parents if there is disharmony at home, or single parents, or they are fighting all the time, or some strict rule in the house. They can affect the child upbringing and mental, because all children are not born with the same aptitude. So some children are very sensitive, some are with careless, some are do not bother with the strictness. So this is the vulnerable children are those who are born with this kind of personality. They are very sensitive. If you just even speak loud, they become very sensitive to that, and it affects their mentis very significantly. So this is when children started being isolated, not talking to the family, not going out, do not enjoy anything at home, or not going out with the parents or with the siblings, or not eating well. Their weight is losing, and their academic achievements are deteriorating. This is when parents started thinking something is wrong, and they pick on it and seek the medical advice.
That's great information you've given to us, Dr. Bano. Now, from your experience, tell us the youngest patient you may have diagnosed or seen with the mental health problem, the youngest age.
Yeah, youngest age could be 5 year, Amara, or 6 year, when child is saying, for example, when they first go to school, although it is minor problem, first time when they send them to school, children do not like going to school. Some are very happy to go to school, but some are not happy to go to school. So every day they come with the abdominal pain or headache. Headache is something which is maybe child do not know what is headache, but abdominal pain is something they know that, or their parents will will be very sensitive about it, or sometimes they even vomit, which is like, we can't say it is factitious, but anxiety can bring up vomiting symptoms. Like adults can be anxious and they can vomit. Similarly, children can be presented with vomiting, but by history we know that when it is weekend, there is no vomiting, there is no abdominal pain. In holiday time, there is no such symptoms. This is how we pick it, and as I said, it can be picked from the very beginning, from school going age or start of school age, which is usually 5 or 6 year old.
So the children can't be that clever to fabricate their illnesses and plan it to show the same symptoms.
Unless parents like us, parents like us who pick very quickly why this abdominal pain happening at 8 o'clock or 9 o'clock, it finishes or it disappears, the symptom disappears.
Yeah. So that does that mean that it is unlikely that a child under the school age could have a mental health problem then? Or is it still
not
possible
necessarily,
that it's not
it is, as I
diagnosed
said,
until they start going to school?
Not necessarily. We should understand, if the child, for example, some children, if they've been escorted by their parents or their parents sit with them, or they have friend in the school, they make friend in the school, they adjusted very quickly. But some people who do not like school, they do not like school. You can say that even in UK, children just do not even finish their GCSE and they come out of school. If they don't want to study, they don't study. Nobody can do anything with that. It is just their personality that they don't want to study, and they come out of school without any academic achievement.
Yeah, thank you very much, Dr. Bano. That has been a very informative session. So at the end, would you like to give a message to our parents, mainly Asian parents, on how and when should they be seeking help if they feel that there is a problem with the behavior of a child, and they should not consider diagnosis of mental health as a stigma, rather than they should acknowledge the diagnosis so that they can be offered help. So any message for the parents whose children are either suffering or they have not been diagnosed yet?
Yes, I must say that parents should be friendly to their children. One, it is very important that there should not be any difference or like distance between parents and the child. We should be friends rather than be strict parents or disciplined parents. We can discipline them, no doubt, but in a friendly way. That children should not be shy talking about their problem to the parents. This is where children get the confidence, and they do better in their school, in their life as well, because confidence comes from home. And as you know that up to 7 years of age, that school or the mother lab is the best schooling till the age of 7, that they can put maximum effort into educating their child, bringing up their confidence, bringing with the information. And we parents should not shy about anything. If they ask something silly question or which we culturally or religiously feel awkward, we should not be hesitant to discuss those topics, because otherwise they will go online or go information from other students which may be very unacceptable for them, or they think themselves or they Google themselves, and this is not very good idea that they look information from other sources rather than from their own parents and siblings. So my main message to the parents is that please be friendly to your children and listen to them as far as possible. If they need any help or they want to discuss something, be open-minded and listen what they're saying and what is their problem. And I believe that this will definitely help in their bringing up and in their future life as well.
Thank you very much, Dr. Bano, for a very informative session, and we appreciate your efforts for your support to the young children as well as their parents with the diagnosis of mental health. Thank you ever so much.
Thank you very much, Dr. Amara.
So viewers, we hope that you benefited from this very insightful session with Dr. Bano. Mental health is a tricky topic, but with her expertise and the insight she has given into how much support is available at the primary or secondary care level. We just hope that if you or your family member or any loved one is facing a similar scenario, please do not hesitate to get in touch with your GP, because the sooner these problems are identified and managed, the better it is for the growth and development of your child. So goodbye for now. We'll be back with another health related topic.